Good day, everyone. I am Michelle Jane Sevilla from BSM 212E220. Today, I'm going to perform the basic life support for infant return demonstration. So, basic life support is emergency management provided by the first responders, healthcare providers, and public safety personnel to people who are experiencing cardiac arrest, respiratory distress, or an obstructed airway. So now, I'm going to perform the infant resuscitation. So since this is a newborn, the first thing to do is evaluate the newborn's transition to extrauterine life using UPGAR score. So UPGAR is a quick test done at 1 minute and at 5 minutes after birth. So the 1 minute will tell us how well the baby tolerated the birthing process, and the UPGAR score for 5 minutes will tell us how well the baby is doing outside the mother's womb. So now for this written demo, let's say that the baby has an UPGAR score of 3, which we know falls within the concerning range. So this means that the baby is in need of immediate resuscitation. So after determining the baby's UPGAR score, we will have to check for the responsiveness by rubbing the soles of the feet or rubbing the back of the baby and calling the baby out loud. Baby, baby, are you okay? Baby, baby, are you okay? Baby, you okay? So after doing that and the baby still has no response, we'll have to position the newborn on his back and call for help to activate the code blue or doctor squeak so that the doctor and the nurses could come over and help us revive the baby. What we'll have to do next is open the baby's airway and suction if necessary. So we'll have to suction the baby's mouth and nose using a suction valve, and we'll have to remove the secretions if there are any that are obstructing the baby's airway. After that, we'll also do the head tilt and chin lift to still open the baby's airway. So after that, and since the baby did not respond to the stimulus we did a while ago, we'll have to perform the positive pressure ventilation. So there are two types of positive pressure ventilation or PPT. It could be through the invasive, which is through the use of ventilator, while the non-invasive one, which is through the use of the pediatric bag valve mask. So this initiated if the baby is apneic and bradycardic. So for this demo, I'm going to use a bag valve mask. So here is my bag valve mask. So what I'm going to do first is attach the BVM to an oxygen cylinder with 100% oxygen. So now cover the baby's entire mouth and nose with it. And now the hand position would be that the thumb and forefinger of one hand will be placed on the rim of the bag mask to ensure that the pressure seal, and the remaining fingers will be placed on the jawline of the baby. So this is done so that our hand is not leaning on the patient's eyes, it's not compressing the baby's neck, and it is supporting the baby's head. So like this. So now we'll be delivering oxygen to the baby for at least 30 seconds every 3 seconds for 40 to 60 breaths per minute. And be sure to maintain proper pacing and look for the chest rise with each bagging. So what we're gonna do is we did 1, 2, 3, 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 we did 1, 2, 3. So after doing that, someone will be attaching a cardiac monitor and pulse oximeter to keep track of the baby's heart rhythm. So the pulse oximeter measures the hemoglobin and oxygen saturation that will help us monitor the efficacy of the CPR. So this time I'm going to do the gentle chest compression. So if the baby's heart rate is still less than 60 or after 30 seconds of the BPV. So to do chest compression, since this is a baby, we will use either 2 fingers or 2 thumb inserting technique like this. So, but this time I'm going to use the two-finger technique. So place the compression fingers at the center of the chest, just below the nipple, here. So now press down approximately 1/3 the depth of the chest, about 1.5 inches. So this is because the baby's bones aren't strong enough or aren't sturdy enough to handle immense pressure, and we don't want to harm the baby by fracturing the baby's ribs or rib cage. And also make sure to allow chest recoil, as this allows the chest to fully expand to pull blood back into the chest and the cardiac tissues. And now provide a 15:2 compression ventilation ratio for 10 cycles. So this is for the two-man rescuers, but since I am the only rescuer, I will perform a 30:2 compression ventilation ratio. So giving CPR: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So we'll have to do that for 10 cycles and evaluate the heart rate after 5 cycles. So if the heart rate is still less than 60, continue chest compression and assist in intubation and giving of the meds. So intubation is where a doctor will insert a tube through the patient's mouth or nose down to the trachea to keep the trachea open and allow air to pass through. And if the heart rate is more than 100, proceed to the post-resuscitation or resuscitative care. So since the patient is or has more than 100 heart rate, so we will now move to the post-resuscitative care. So we could refer the post-resuscitation care algorithm because we could find there the procedures and tests that need to be done to ensure that the baby is doing fine and that the baby's body system is working. So post-resuscitative care, I know, is through monitoring the administered oxygen concentration and the arterial oxygen saturation. So after doing the procedure, we'll have to proceed to the documentation process, where we will have to input the time it started until the time it ended, the assessment, and also the response of the baby to the medication and treatment.